Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3 Dental Sleep Implementation System. Thanks for tuning in to this month's edition of Dental Sleep Medicine Insider Magazine. Today, you may have guessed, we're going to talk about a mandibular advancement device. In specific, we're going to talk about the Micro 2. I've been wearing this device a lot myself. As a matter of fact, I have it in right now. That's why it sounds like I have a little bit of a speech impediment. So I think I'll take it out to finish talking about this, but you can see how small and lightweight this dental device is. It's one of my favorite devices. I wear one every night myself, and we do hundreds of dental devices in our practices each month. And some of the new features on this device are unlike any device we've used in the past. So I'm going to go through it with you for just a few moments and let you understand where it may fit into your dental sleep practice. First of all, the features of this device. It's one of the most lingualist devices. It's much like a dorsal design, but the wings are more of a 90-degree angle as opposed to angled with the dorsal design. It's a CAD/CAM made device, so these devices are made on the computer and basically made out of a block of acrylic. It's a really dense block of acrylic that is milled specifically for each arch. It's easy to adjust and clean. There's no movable parts. This one doesn't have any screws or anything you do because I'll show you in just a moment. You just put in different trays to get different levels of advancement. It's one of the most aesthetically appealing, and as far as I can tell thus far, we've been using it quite a while now, and it's quite durable. The way we adjust this particular device is you can get it in two basic ways. You can get with 4 trays or 2 trays. On the screen here we have with the 4 trays, and essentially the trays are made with the wings at their various positions. If you want 3 millimeters total range of motion with the 4 trays, you can do these increments in 1 millimeter increments. So in a combination between switching the upper and the lower trays out, you can get anywhere from 0, 1, 2, and 3, as you can see all along the left side. If you want to have a total range of 4 millimeter range of motion with the 4 tray selection, then the increments will be more or less in a 1.5 millimeter increments, as you can see along the side of the screen here. There is an option too that you can get 6 trays, so it'll be 3 uppers and 3 lowers. With the 4, there's 2 uppers and 2 lowers, and again, by combining them, you use this kind of guide to tell where you are. So with the 6 trays, you can get 4 millimeters of advancement versus 6 on the right side. And the difference there, the left side with the 4 millimeters, your increments are 0.5 millimeters between each increment by combining the trays. Or on the right side, you can see if you want the 6 millimeter type when you make your order with Microdental, these will be 1 millimeter increments, and you'll get a total of 6. Now the advantage is, don't get too hung up and worry about, well, I've only got 4 or 6 millimeters of advancement. They keep all of your information on file, and if you want another tray, you can call up and order it, and you can get even further advancement if you need to down the road. The pros to this device are it's very durable. It doesn't absorb stain or odor because it's that really dense acrylic. So over time, it'll remain looking just like it does. It is really one of the easiest ones to seat and adjust. We have to do very little adjustments on these because, again, they're CAD/CAM, and the CAD/CAM devices seem to have a lot less adjustments. So most of the time, they just go right in. They're lingualist. That's hard to say, but there doesn't have much material around the lingual, which is what we oftentimes want in a mandibular advancement device. And again, your impressions are stored. So we know sometimes dogs get a hold of these devices, patients drop them or break them for other reasons, and you can always just call them up and they'll send another one right back out, so you don't even have to take new impressions. And again, we can also change the advancements by just sending in a new lab script. The cons are, right now in my practice here in Florida, we have a lot of Medicare patients and it's not Medicare approved. There's a little bit of a learning curve when you look at those switching the arches back and forth. It takes a little bit of getting used to and looking at the guide, but it's quite easy after you get used to it. I can say probably the one con that I've run into occasionally, again, these fit very well, so we don't have to adjust them much. If you have to adjust one because a tooth's a little sore or it's high on one spot, we're going to have to do that on all the arches for that particular arch. So if you got the 2 arch model, you'll have to do it on both of those. If you end up using them, if you have the 3 per arch model, so 6 total, you'll have to do it on 3 of those. But again, that doesn't happen that much, and it isn't the most costly device out there. It's a little bit more than some of them that you might run into. So the people we're going to use this on, more or less, people with large tongues, I think it's an ideal device. It doesn't take up much tongue room. Much like any other device that allows your mouth to open, when you have retention issues, you have minimal teeth, even edentulous. I haven't done it on an edentulous patient, but I think it would work fairly well because anytime the mouth can open, these devices don't have to fit quite as tightly to stay in. Aesthetically, it's one of the most aesthetically pleasing, and patients put these in and they're just like, wow, this thing is nice, and it doesn't, it's not got a bunch of metal pieces and so forth. The negative is, again, it's not Medicare approved, and it's a limited range of motion unless you order multiple more trays than maybe it comes with. Again, I think it's a great device. It has a lot of positives. Patients really seem to like it. One thing I'll mention that's not even on the screen is anytime you allow your patients to open, a lot of times you have to put rubber bands between the arches or the devices don't work as well. Because of the 90-degree design on this, that's not as often needed. So again, you should try this out on some of your patients. I think you'll find it to be a very comfortable device for your patients, one that works quite well, and patients accept it quite readily. So let us know if we can be any other help for you at Dental Sleep Solutions and DS3. And thank you so much for reading this edition of Dental Sleep Medicine Insider Magazine.